So Buurtzorg was founded in 2006 by Jos de Blok in the Netherlands, and honestly, it was a direct response to what he saw as inefficiencies plaguing the healthcare system there. At the time, health services were heavily fragmented, nurses were being pushed to spend more time on paperwork and less time on actual patient care. It was frustrating. Healthcare was being treated like an assembly line.
That sounds exhausting. Was there a breaking point that led to this shift? What made him say, okay, I'm done. Let's start something from scratch?
Exactly that frustration. De Blok had been working within the system but felt like it wasn't serving either the patients or the professionals. So he went back to basics. His idea was actually pretty simple. Return the focus to patient care by trusting nurses to make decisions. And that's how Buurtzorg's model of small self-managed teams was born. These teams are usually made up of 4 to 12 nurses.
Wait, no managers? Okay, before I dive into this, I remembered that we need to remind the listeners. This podcast is generated by AI and hosted by AI clones, all with creation, guidance, and editing by Dr. Chad Swanson, a full-time ER physician with a passion for transformational change in our health system. Dr. Swanson considers this daily podcast an informal conversation with the world on transformational health systems change. As such, while he edits the AI-generated text and follows up on sources, this should not be considered a definitive source of knowledge. Anyway, they have no managers?
None. The teams are completely autonomous. They make their own schedules, decide how to allocate resources, and coordinate directly with patients. It's all based on trust, and it's remarkable because it cuts out so much bureaucracy. But here's the thing. This isn't just a feel-good idea. It works. Research has shown these teams are not only more efficient, but also deliver better outcomes.
Okay, so let me get this straight. Instead of middle managers telling nurses what to do, the nurses themselves decide how to run things day to day?
Right. The principle behind this is pretty clear. Nobody knows the needs of a patient better than the person providing their care. And when nurses have that freedom, not only do they feel more empowered, but they can actually spend more time with their patients. Buurtzorg estimates its staff spend up to 60% of their time on direct patient care, compared to roughly 30% in traditional systems.
That's a massive difference. It's double.
It is, and that efficiency comes with better patient relationships and, importantly, job satisfaction for the nurses. This model challenges the idea that you need hierarchy to be productive. Basically, trust and autonomy can make a huge difference.
This reminds me of trends in tech, where self-managed teams have blown up. Software developers organize into these small groups, scrum teams, and they work almost independently, sometimes with minimal supervision. It's kind of fascinating to see true patient care benefits tied to similar principles.
Exactly, and Buurtzorg's vision goes beyond just cutting the red tape. It's really about rethinking the relationship between care providers and their communities. Instead of operating like a hierarchy, Buurtzorg places the community and patients at the center, with the nurses acting as connectors. They're solving actual local problems rather than squeezing into a one-size-fits-all model.
And I'm guessing this kind of autonomy also means the teams need to be pretty tight-knit, right? You build trust on both sides, among the nurses and with the patients.
Exactly. It's a different mindset. You're not just treating symptoms, you're addressing the environment and root causes. It's holistic, and it shows how small teams, even without rigid control, can essentially revolutionize community healthcare. So, we've talked about the how. Now let's look at the impact. Buurtzorg didn't just revolutionize healthcare for the sake of it. They've shown that this model works. For instance, over 90% of their patients report high satisfaction with their care. It's a staggering number when you compare it to more traditional systems.
Wow, that's really impressive. So what's driving that? Is it just the extra face time with patients, or is there more to it?
A big part of it is continuity of care. Patients aren't shuffled from one caregiver to another, which builds stronger relationships. That trust directly impacts outcomes. For instance, in traditional systems, you might see different people for each phase of care. But with Buurtzorg, the same nurse who gets to know you during treatment is probably the same person helping you recover and manage ongoing needs. It's much more holistic.
So instead of retelling your story to multiple people, you've got one person who really understands your situation?
Exactly, and beyond patient satisfaction, it's also about reducing inefficiencies. Research shows patients are hospitalized less often under this model. That alone is a huge financial benefit. It saves patients, providers, and the system as a whole a ton of money.
Right? Because you're catching issues early on or managing them before they snowball into bigger problems?
Exactly. And the numbers reflect that. Buurtzorg's structure drastically reduces administrative overhead, making their care not just better, but cheaper. For example, in 2013, a study found Buurtzorg's annual cost per patient was 40% lower than the national average in the Netherlands. It's incredible, especially when you think about how hard it is to balance financial sustainability with quality.
Yeah, because the usual argument is you can't have both. Like, you either get effective care or you keep costs down, not both at the same time. And here they are, doing it.
Exactly. And what's even more interesting is the global ripple effect. The Buurtzorg model has inspired similar initiatives across the world. Countries like Sweden, Japan, and even here in the US are exploring how to adapt it to their own systems.
Wait, so they're exporting this idea? That's kind of wild. Do these adaptations work the same way? Or is it like one of those lost in translation things?
It depends. Healthcare is deeply cultural, so adjustments are necessary. Take Japan, for instance. They emphasize intergenerational family care far more than in the Netherlands, so integrating Buurtzorg principles there requires a different approach. In the US, scaling it up is the challenge. Our system is so fragmented, and there's this entrenched idea that more bureaucracy means more accountability, which isn't always true.
So there are hurdles. It's not just plug and play.
Right? But the fact that it's sparking conversations and experiments globally is a testament to its core idea. It's fundamentally shifting how we think about healthcare delivery. And despite the challenges, the model proves that priorities like trust and autonomy can work almost anywhere if the foundation is strong.
So it's not just a one-country success story. It's shaping the playbook for healthcare reform.
Exactly. What Buurtzorg has shown is that even small, localized teams can create systemic change, which is something many healthcare reforms have struggled to do. As Buurtzorg's success inspires global adoption, it raises a crucial question. How do you scale something so innovative while staying true to its core values? One of their toughest challenges has been maintaining that deep sense of trust and autonomy across larger, more complex systems as they expand to different countries.
Yeah, I've got to ask though, what happens when you grow too fast? I mean, does it dilute that whole self-managed, community-focused vibe?
That's exactly the risk. And here's where it gets interesting. Other health innovations have struggled with this same thing. For example, programs designed for patient-centered models often get bogged down by bureaucracy as they expand. With Buurtzorg, the challenge is ensuring that those small, self-managed teams don't lose their autonomy or start looking like traditional hierarchical systems.
It sounds a little like scaling a startup, right? Getting bigger, but trying to keep that scrappy, innovative spirit.
Right, and just to add, another hurdle Buurtzorg has faced is integrating with traditional healthcare systems, which are often resistant to change. The idea of, giving up centralized oversight can feel threatening to older institutions.
Okay, so they're like, we've always done it this way. Why fix what's not broken?
Exactly. But in this case, the system is broken. And what's fascinating is how Buurtzorg continues to push boundaries, even if the traditional frameworks push back. For example, their approach to integration in countries like Sweden and the UK has required significant compromises to align with existing regulation and infrastructure.
But it's not just logistics, right? I'm guessing there are cultural differences that come into play too?
Absolutely. Healthcare systems are deeply embedded in societal norms. What works in the Netherlands isn't always going to map perfectly to, say, Japan or the US. Japan, for instance, integrates Buurtzorg's methods into a culture that already prioritizes family-based care. In the US, though, we're dealing with a fragmented healthcare system influenced by profit motives, so adapting their model is a huge challenge.
I mean, fragmentation feels like basically the Everest of challenges. Have there been ideas about how to weave Buurtzorg into something as complex as US healthcare?
There have been some interesting experiments. The key is finding ways to replicate those core principles, autonomy, trust, patient-centric care, and fit them into the existing structure. One approach being floated is creating pilot programs within specific communities, allowing teams to demonstrate success on a smaller scale before expanding.
That makes sense. It's like you adapt the playbook instead of copying it word for word.
Exactly. And while it's not a perfect system, Buurtzorg offers a framework for what's possible when you think beyond traditional models. It forces us to ask how we can balance efficiency with compassion, especially in a system like ours.
And that's the big question, right? How do you find that balance without losing what makes it all work in the first place?
I don't think there's a single answer, but Buurtzorg proves you can build a system that's not only effective, but also deeply human-centric. And that's a message worth holding on to. Regardless of the challenges, it's reshaping how many of us think about healthcare reform, even here in the US.
Yeah, it's kind of inspiring, honestly. Like, who would have thought small teams with no managers could start a revolution?
Sometimes big changes start with small ideas, and they remind us that even the most entrenched systems can evolve if we're willing to challenge the status quo.
On that note, this has been a fascinating dive. There's a lot to think about here.
Absolutely. It's been great to explore this with you and our listeners. Hopefully, it's given people a new perspective on what's possible in healthcare.
All right, until next time, everyone, take care.